Hello everyone, I am Dr. Shailesh Mohan Badole. I have my own neurocare clinic in Manikonda. I am a neurophysician and today I am talking you regarding various neurological problems. Like in neurology there are many things like most common things are like brainstroke or any fits or seizure or epilepsy, and there are many other things like headache or vomiting and migraine, and many patients are suffering from back pain, neck pain or spondylosis, and various other things like vertigo, giddiness or balance issues, and some cranial nerve issues like loss of vision or any hearing problem, or some other things in cranial nerves like swallowing difficulty or change in voice, and some other things like movement disorder like Parkinson disease, and some patient will have other movement issues like tremors or hyperkinetic movement disorder like dystonia or spasticity or myoclonus, or some other like heminalsmus. So today our topic of discussion is brainstroke. So brainstroke is very common in India, and there are two types of brainstroke. One is hemorrhagic brainstroke and one is ischemic brainstroke. So if hemorrhage occurs, it can be due to sudden rise in blood pressure or due to some blood vessel rupture inside the brain, and in that we have to manage with BP control and anti-edema measures and some anti-epileptic to control the fits and some other medications and some physiotherapy. So depending on patient condition, patient may require surgery sometimes depending on the area of brain involvement. So another brain stroke type is ischemic stroke. So it is very common in 70% cases ischemic stroke happens, in 30% cases hemorrhagic stroke happens. So in ischemic stroke there are few things which are important. So if patient develops some speech difficulty or facial weakness or swallowing difficulty or loss of vision or anything like that, so if patient comes in hospital within 4.5 hours, there are some injection available in market like tenecteplase or altiplase, which will lyse the brain clot. So patient, depending on the NIHS score of stroke severity and patient GCS, that patient may require thrombolysis with tenecteplase or altiplase. So if any patient have any vascular abnormality like blockages of some major artery beyond 4.5 hours and within 24 hours, depending on the patient condition, such patient may require mechanical thrombectomy, which is called in that thing the clot will be suction through that arteries to clear off the clot. So remaining thing, if patient is coming beyond that period like beyond 24 hours, or where we are not able to thrombolyze patient, or where we are not able to do mechanical thrombectomy, such patient requires medication like antiplatelet, statin, and in high dose, and BP we have to monitor. Some patient, if there is any atherosclerotic or severe blockage, that patient require BP augmentation and some other things like IV fluid and some infection control, and we have to monitor their GCS. And depending on the size of clot, such patient may or may not require surgery, and depending on the progress of symptom or depending on the GCS Glasgow Coma Scale of patient, such patient we have to monitor, and remaining thing like physiotherapy and nursing care and bed sore prevention and aspiration prevention, and some patient may require rise to feeding if there is any swallowing difficulty. So all these things we have to take care. So if anybody have such symptoms, kindly see your nearest neurologist. Thank you.